Let me let her in. All right. All right. All right. Happy Monday, ladies. The last day of March, which I cannot believe it is here already. But anyway, we're here. So happy
Years flying.
Monday. I know. Happy Monday. Menopause Monday today is going to be a good, good one. Um, we are talking about pelvic floor health, and pelvic floor health is such an under-discussed. Natalie and I were talking about this the other day. Under-discussed, but it really is a critical area for women in menopause and perimenopause. And truthfully, I feel that a lot of women don't want to talk about it because there is some kind of embarrassment around it, or not, or maybe they're not sure. But we're going to talk about
Yeah.
it today. We're definitely going to talk about it today. And today, of course, we have Dr. Chitra Cherian. Sorry, I have to sneeze. Oh, sorry. Pelvic health physiotherapist. Who on, and we'll be talking about this very important topic. But first, let me tell you a little bit about you. You are board certified in biofeedback for pelvic muscle dysfunction. I want us to talk about that during the session because I'd love to hear a little
Sure,
bit more about that.
sure.
You're also PMA certified Pilates teacher and a level one bar instructor. So welcome, welcome, welcome.
Thank you very much.
Love to have
Yes,
you.
Chithrah, thank you so much for being here.
No
Chithrah is
problem.
a wealth
My
of knowledge.
pleasure. Thank you for having me.
Of
All
course.
right. Let's get started, Nat.
Yeah, so let's jump right in. Like your title there, Chithra. Tell us a little bit about more, like, a little bit more about what your certification, what your specialization, what does that involve?
So, pelvic floor has to do with any muscles that surround and support the bladder, the vagina, the prostate, the urethra, and the rectum, right? And
Okay.
pelvic floor really forms the base of the pelvis. So, I've been a physical therapist for, I think, the better part of 16 years, and I've been doing pelvic health for 14 years. It's not a very well known topic for sure, but we as pelvic floor therapists are trying to increase awareness in this field because there's so much we can do to help persons going through pelvic floor symptoms. And it's not very well discussed for some of the reasons that Nikki even mentioned. So I got my certification in biofeedback. I will speak about biofeedback when we get into the physical therapy intervention, but it's really a tool,
Mhm.
the only tool that assesses pelvic floor muscle tone.
Well, that's interesting.
Okay.
Yeah.
Okay. So actually, can we jump right in there? Like, what is biofeedback and how do you use it to assess
Okay, so
tone?
biofeedback is a tool. It actually uses this electrode, which is a vaginal electrode. It has electric, not electric, but metal plates on the side, which detect muscle activity. So it is inserted vaginally. There's also another
Mhm.
smaller one, probably the size of my finger, that's inserted into the rectum.
Mhm.
And it really helps patients to identify and isolate the pelvic floor muscles. So there is audio feedback through sounds, and
Mhm.
there's visual feedback. So a graph is plotted on the screen when they contract around this electrode. And you can see, and there are other electrodes that are attached to their abdominal, their inner thighs, their glutes. So you can see, or they can see when they contract the muscle and
Mhm.
see activity in the pelvic floor, or you don't if they're not using
Mhm.
the floor, or if they're
Mhm.
using the abdominals instead of using the pelvic floor. So it's really a great tool to teach patients to isolate how to contract their pelvic floor. I
Okay.
mean, research states that 30 to 65% of persons do not know how to do a proper pelvic floor muscle contraction. But if
Mhm.
you ask me, I would say it's more like 85%, you know?
Okay.
And patients will come in and say, oh my gosh, I've been doing these Kegels forever and nothing is
Yes.
helping me. I'm still leaking all over the place. And I'm like,
Yes.
well, you probably aren't doing it properly, you
Aren't
know?
doing it right.
Let's
And
check
that's
it.
where the biofeedback comes in.
Absolutely. And it doesn't always have to be biofeedback. Sometimes it's just giving them the right cues on how to
Hmm.
control or contract and relax the pelvic floor muscles that helps them. Sometimes they say, oh, that works for me, you know, and not
Uh-huh.
stopping the urine midstream.
Uh-huh.
Because to be honest with you,
Okay.
it's very hard to stop urine midstream, especially if you're having a heavy flow of urine, you know?
Okay, well, I have a question. Let's get back
Yeah.
to the beginning when we talk
Yes.
about why.
I
I
was
know,
gonna
because
say, let's rewind. Yeah.
yeah. So let's talk a little bit about why. Why does this happen to women during perimenopause and menopause? Why does this? We have these, leaks or these oops, as Natalie says, like when you sneeze or you cough. Why is that happening to us during menopause and perimenopause?
So estrogen plays a very important role in maintaining the elasticity and strength of ligaments and tissues and muscles that surround and support all these pelvic organs, right? So that includes the pelvic floor. So as estrogen levels drop during menopause, the pelvic floor muscles become weaker and less elastic. The ligaments that support the organs and keep them in place become more lax, allowing these organs to actually drop or descend into the vagina, which is what is termed pelvic organ prolapse. And that comes with its own barrage of symptoms, with the leakage and the constipation, sometimes pelvic pain, and a whole other list of symptoms.
Estrogen. There we go
Wow.
again.
Okay.
And estrogen is
Estrogen,
also
falling estrogen,
responsible.
exactly. Yes.
Yeah.
Sorry, estrogen is also responsible for producing a sticky mucus that closes the urethra shut, so to speak, which helps with
Hmm.
continence. So, with a decline in estrogen, there's decreased production of this mucus, which leaves the urethra a little more open, allowing you to leak. And it
Mm.
increases your risk of incontinence. And estrogen is also responsible for producing lubrication in the vagina. So, with a
Right.
in estrogen, you get vaginal dryness and painful penetration or painful intercourse.
Yeah.
Right.
So,
So we live we live in a we live in a hot country, right? And we do have sweat glands in the groin area,
Mhm.
right? So how does a woman tell if it is sweating that is occurring in the area, which is why her, like, one of the ways you tell that you're leaking or not leaking is that you've got a moist undergarment, right?
Mhm.
But you could have a moist undergarment due to the fact that you're sweating, because we live in Jamaica and we have sweat glands in our groin area. So how do you tell if it is sweat or if you are actually experiencing leaking or something like that?
Okay, so that's actually a very good question. Now, there are a couple of things you can do. First of all, color. But if your urine tends to be color, then meaning not as colorful or no
Hmm.
color, you can't use that. Smell
Hmm.
is another way, right? Some people can, just smell the liner. But the most accurate way of checking if it is urine or sweat is there is a pill that you can take that colors the urine. I think it comes out in like an orange color.
Oh,
Yes, so that will then differentiate whether it's urine or sweat. So if you're not sure, that's the way to go.
wow.
wow. I
Didn't
did
even know
not
that.
know that. That's,
No.
yeah, that's really
Um,
amazing.
Wow. Okay. So you talk about pelvic organ prolapse. What exactly is that?
Prolapse.
Yeah. What exactly is
so
that?
pelvic organ prolapse occurs when the muscles and tissues that support the pelvic organs weaken, causing them to drop or protrude into the vagina. So there are different types of prolapse. So you can see here the organ. So this is the bladder, this is the uterus, and that's the rectum at the back. Can you see that?
Hmm.
Yes. So if the bladder drops into the vagina, which you can see either at the vaginal opening, depending on where it is in the vagina, will determine the severity of the prolapse. So if the bladder drops into the vagina, it's termed an anterior vaginal prolapse or a cystocele. The uterus can drop into the vaginal vault, right? Or into the vaginal canal then. And you can also have a rectocele, which is where the rectum bulges into the vagina. As I mentioned, there are different grades, different severity, and the severity will determine what treatment you offer the patient,
Are
basically.
there symptoms? Are there symptoms of this?
Absolutely. Well, if it is mild, there are no symptoms. But if it is a little more severe, where it is coming to the opening of the vagina, patients report that they can feel it when they're wiping. So they'll feel a little
Oh.
bulge in the vagina when they're wiping. There's urinary incontinence. They can have urgency and frequency of urination, post-void dribbling. That's where after you urinate, little urine dribbles out. There's hesitancy in starting a flow of urine. There's incomplete emptying, where they feel like they're not emptying the bladder or the bowel for that matter properly. So if there's a rectocele, for example, where the rectum bulges into the vagina, a little pocket forms where the bulge is. So stool collects there. So they would think that they finished going. As they stand up, they feel the urge again to have a bowel action. So those are the symptoms. And sometimes they have pelvic pain as well. So it really, as it determines on what type of prolapse it is and how bad the prolapse is.
Chithrah, some of this stuff sounds really scary.
Yes. Is this something common that you see with your patients?
Absolutely. So what happens is I don't see them until it becomes so bad that they seek help. When it is very mild and the symptoms are barely there, persons assume, oh, the leakage is just part of aging, it's part of the course. That it's not normal. Incontinence at any stage is not normal. So that should be the first sign to say, okay, I may have a pelvic floor dysfunction. Let me go and speak to a medical provider.
Okay, that's very, very important. Wow.
So
okay,
I know that like personal experience, right? So I've had 3 children. I've had one of them naturally. I had to have 2 C-sections, but I had my first child, right? I did recognize that after, like, there'd be moments when, like, say I was out dancing or even doing jumping jacks in the gym, right? If I start to do jumping jacks, I feel like, oh, I need to excuse myself and go to the bathroom, right? So this is not even just related to perimenopause and menopause. This can be related to just being a woman and having had children, right?
Absolutely, absolutely. I mean, that's one of the major risk factors to developing a pelvic organ prolapse, vaginal childbirth. And the more vaginal childbirth you have, the higher the risk. Being overweight is also another risk factor. Chronic constipation is a big risk factor, which is not, commonly considered because you strain with bowel movements. So straining over a period of time will put pressure on those ligaments that are holding the organs in place. So it increases intra-abdominal pressure. It also puts pressure on the pelvic floor.
Wow, I know.
Studies actually indicate that nearly half of the women between 50 and 79 have some type of prolapse.
Wow. So with all, when we talk about this, is it you have to do something, you have to fix it, or can people live with it on a small scale and do exercises and that kind of stuff, or do you have to have surgery or whatever it is to fix it?
Right. So the treatment, as I mentioned before, will depend on the degree and the type of prolapse.
Okay.
If it is stage 1 or stage 2, and I'll explain what stage 1 or stage 2 is. Stage 1 is where it has barely descended into the vagina, so you can't really see it. A medical provider will need to look in to see, right? Stage 2 is where it's right at the opening of the vagina. And stage 3 is when it has come out of the vagina. So when you bear down, you can actually see ballooning out of the vagina. Now, pelvic floor physical therapy can help if it is stage 1 or stage 2. Help, not reverse. Pelvic organ prolapse cannot be reversed, but pelvic floor physiotherapy can help to prevent the progression of it to some extent with the pelvic floor exercises. So, you basically strengthen those muscles, offering a seal to support the organs better. If it is a stage 3 where it's coming out of the vagina, a conservative management would be pessary. So it's a little disc that's inserted into the vagina, which holds the organs in place. A pessary is great, even if it is stage 1 or stage 2, because it helps the pelvic floor to work better. Imagine the pelvic floor and something heavy sitting on the pelvic floor. It can't contract and relax as you'd want it to, but you take the weight off and it can then contract and relax. So we can train the pelvic floor better if the pessary is actually holding the organs up. If it is coming out of the vagina, then surgery would be the only option.
Okay.
Wow.
What about we hear, we see things and everybody we have our different like little sources of information and there's we hear about yoni toning and yoni eggs and Kegels and to what extent are these things helpful, detrimental?
So
Talk to us
there
a
will
little bit about that.
always be things on the market, suggesting different things with respect to strengthening pelvic floor muscles. I want
Hmm.
to say this: Kegels or
Hmm.
Kegel, as
Kegels.
correctly pronounced, Kegel like bagel.
Kegels. Okay.
Yes.
Oh, Kegel like bagel. Okay, good, good.
So
Thank you.
it is not for everybody. It can actually
Okay.
make it worse. The correct terminology is actually pelvic floor muscle exercises. It's not called Kegels anymore because Kegels
Okay.
refers to very specific type of exercises that was developed by Arnold Kegel in the 1950s. So the medical
Okay.
practitioners, technically speaking, don't use that word. We say pelvic floor muscle training, pelvic floor muscle exercises, because it encompasses so much more than just
Okay.
contract and relax. Having said that, you need to see a pelvic floor physiotherapist or a gynecologist or urologist to determine if strengthening is the right thing for you. We can tell you if strengthening is the right thing for you. Some people develop this reflexive holding pattern where the pelvic floor is so tight that if you then start to strengthen it, you end up in a worse situation.
Mm,
My.
okay.
Yes, I mean,
One way
to
or
answer
the
your
other.
question, Natalie, the pelvic floor weights, absolute, they're excellent. I mean, I recommend them too for persons who are candidates for pelvic floor weights. And
Right.
it's just like muscle training for everywhere else in your body, but
Hmm.
it's for the vagina. And it comes in different weights,
Right.
lightest weight to the heaviest weight, 20 grams to about 70 grams thereabout. And the goal is to be able to do functional activities with this weight in without the weight dropping out.
Yes.
So you're strengthening endurance in the process.
Gotcha.
And there are many
Gotcha.
similar
Gotcha.
things on
Gotcha.
the market which work towards that goal.
Do
You
you?
talk about, sorry, go ahead, Nikki, go
No, no,
ahead.
no. Go ahead, Nats. Go ahead. Go ahead.
You talk about doing exercises with the weights in place. So I notice that when a woman is in the gym and she's doing like, say for example, squats, okay?
Mhm.
If you don't consciously engage your pelvic floor before you squat, you can actually find yourself bearing down while squatting, right?
Absolutely.
What does that mean for strengthening, weakening, relaxing, toning? Like what's the implication of that if you're
Um,
just doing squats?
so there's so much more to a squat than just, engaging versus bearing down. The
Hmm.
pelvic floor is one of four core muscles, right? With the diaphragm being at the top, the abdominals at the front, and the lower back muscles along the spine. The pelvic floor offers pelvic stability and lower back stability as well. It's actually quite crucial in maintaining pelvic stability. Your pelvic floor should engage with a squat to maintain pelvic stability. And ideally, you should not be holding your breath when you're doing these exercises or these squats because holding the breath puts added pressure on the pelvic floor. And it increases intra-abdominal pressure. Your diaphragm is not moving as it should because the diaphragm and the pelvic floor are very intricately connected. So, to answer your question, what this means for the pelvic floor is first, you have to know what muscles to engage to get the outcome that you want, right? Pelvic floor exercises will definitely
Hmm.
help with stability and help with any symptoms that you are experiencing as a result of pelvic floor dysfunction. But if you're not doing a particular exercise correctly, you will always end up putting pressure on that pelvic floor.
How do we know when we talk about, like
Yes.
Natalie just says, you talk about engaging your pelvic floor. How does a woman know how to engage her pelvic floor when she's doing a
So
squat?
that's
Because I'm
where
thinking
we
about
come
when I
in.
go to the gym, I'm like, oh my God, am I doing this thing right? How
So
do we
as
do
I
that?
said, that's where we come in, pelvic floor is not just squeeze and relax. It's isolated, yes. So we teach you how to contract the pelvic floor muscles and show you if you're doing it correctly. Not everybody has the strength to do a proper pelvic floor muscle contraction. It's like anywhere. So I want to know how strong my biceps are, right? And I want to know how much of a weight or how many times can I do this contraction with the bicep. The pelvic floor is the same. If somebody does an isolated pelvic floor contraction and they're doing it correctly, they should be a grade 5 out of 5, meaning maximum resistance. They should be able to hold my finger and lift it up. Not everybody has that, especially if you have any issues contributing to pelvic floor dysfunction, if you've had a C-section, if you've had vaginal childbirth. Most women I find are about a 3+ or 4 out of 5. And the endurance is usually weak. So good endurance, that's how long you can hold a contraction, is about 15 to 20 seconds. Most persons, men and women, can't go beyond 5-8 maximum. Yeah, so they have to know how to contract the muscles properly. So as I said, that's where we come in without using any other accessory muscles, which is the inner thigh, glutes, abdominals, breath holding, etc. And then we say, okay, run with that, focus on that, work on that as you're doing your other functional activities or exercises.
Okay. Well, that's very important for women to know that if they're having any kind of issues or think they're having any kind of issues, to go and consult, start with their gynecologist if they feel more comfortable with them, see if there's an issue, and then know that there's an option with you that they can, to strengthen that, like you talk about going to the gym and strengthening the muscles, which is, I love that. Let's talk a little bit about why. Let's talk on the sex side now. Why is it that sex becomes painful for women during menopause?
Again, we go back to decreased estrogen levels leading to vaginal dryness, thinning of tissues, decreased elasticity, making penetration uncomfortable or painful. And it's a whole cycle. So this in turn can cause pelvic floor muscles to tense up, further exacerbating pain and potentially leading to pelvic floor dysfunction. So I know. So it's just to find out where to break the cycle.
Yeah.
Yeah. So lubricants, that's where lubricants come in, supplements that can help with collagen production. You can check Natalie at the Life Store for these wonderful supplements.
Thanks, Chithrah.
Yes, but I mean, lubrication is very important, whether you want to go natural or, water-based lubricants or oils, very important to, again, break that cycle. Over a period of time with painful intercourse or painful penetration, the pelvic floor muscles can develop knots, just like how you develop knots in the triceps from holding, you can develop knots. Again, that exacerbates pain. It just makes everything worse. So we can use this little device, aside from manual release of the trigger point, where you can press and release the trigger point. This is a pelvic floor wand. It can actually, we teach the patients how to insert it and press on the trigger points in the pelvic floor to alleviate pain.
That's very interesting. Wow. So that also ties into the whole fact with constipation there, because a lot of women going through menopause with the whole hormonal changes suffer from constipation. So that now, again, as you're explaining to us, it's going to have the same effect on the pelvic floor with the contractions and all of that. Yeah. So that's something that we should think about as well, right?
Yeah, and we can teach them different techniques to help with the constipation. I mean, if you don't remember anything else from our talk today, remember this: never strain with a bowel movement. Never. You should, be patient. Find a time of the day that works for you. Use a squatty potty. Do you know what a squatty potty is?
Yeah, well, I've heard of it. Yes, yes.
So it's a little stool. The height will depend on the height of your toilet. You place your feet on the squatty potty, turn them out, and rest your elbows on the knees. It helps to straighten. This is the rectum, by the way. It helps to straighten the anorectal angle. So you see this little kink? We're looking at it sideways. So this is the front here, and this is the back. Okay. So at a resting position, the rectum has a little kink, which is what maintains continence. This kink needs to be straightened out for you to have an effective or a good bowel movement. So the squatted position helps to straighten out this angle, which is where the squatty potty comes in.
That's interesting to know.
Yeah. And breathing, of course, take nice, big, deep belly breaths, as we call it, to relax and help with the bowel movement. But again, do not strain.
Do not strain and get those get that, having the talks with your doctors as far as if you are suffering from constipation, what you can do, not, I mean, obviously hormonal wise, but diet and nutrition and
Yes,
exercise, all of that,
yes,
supplements to help women through their menopausal stage of fluctuating hormones that does cause constipation.
yes. And I mean, as I said with the painful intercourse, what happens with chronic constipation is that there is a reflexive holding of the pelvic floor. So you find that some of them may need biofeedback to help them learn how to relax the pelvic floor muscles. It doesn't make sense you're pushing down or straining from the top to evacuate, but the pelvic floor is holding the outlet shut. So you have to learn how to relax the pelvic floor.
Wow. Okay. Nats, do you have any other questions on that before we move on to maybe like treatments and different stuff that we can do? Oh, she's muted. I guess she's busy.
No, I'm here. I'm here.
Oh,
So this is just like such wild information because we're constantly bombarded with we should do our Kegels, we should do, but truthfully, we really need to like have a consultation once you've been pregnant, it sounds like, Chithrah. Once you've
Absolutely.
been pregnant or had a child, it sounds like we
Absolutely.
should do
And
a
even
consultation to maintain, like, to get guidance and feedback on the health of our pelvic floor and what we can do to maintain that.
Absolutely. And even if you've never been pregnant, I mean, there are women in their 40s, early 50s who are experiencing symptoms of pelvic floor dysfunction and they've never been pregnant. So the information is always important. Like I said, chronic constipation can cause incontinence. It can cause pelvic organ prolapse. So even if you've never been pregnant, it's always a good idea to get the information, especially because it's not so readily or wide. It is widely available, but it may not be accessible, unless you go looking for it. There are no ads about, pelvic floor health that come up on TV and what to do, and pain with intercourse is not normal. You won't see that.
no, they're always about treatment. They're not about being proactive. And I think what
Right.
Natalie is saying here is that I think women need to be proactive. Do not
Absolutely.
wait until you are in the dire straits to go and have these consultations. But let's touch a little bit on the embarrassment side of it then, the shyness side, because there are women who don't want to talk about it. They're don't think anything is wrong. What advice, what would you share with these women to say, listen, this is normal, this is okay?
Well, what I would tell them is take the time to learn about the topic. There are numerous resources available on menopause, perimenopause, the symptoms, even if you're not in menopause or perimenopause. Seek these resources. Seek the specialists. So, your gynecologist, your urologist, your general practitioner, if you prefer speaking to your general practitioner, the endocrinologist, us, pelvic floor physiotherapists. Seek the resources. Seek us. We are here to help. We are here to improve your quality of life. You may be comfortable talking to a friend. However, please remember they do not have the knowledge that medical providers have, and the advice they give you may actually cause unintentional harm, may make your symptoms worse, right? And, I want to share a statistic with you. Hang on while I pull it up. So, according to the National Association for Continence, 1 out of 2 women have some form of incontinence, and only 25% of women bring up their leaks with their doctors. On average, women only seek professional help 6 years after symptoms begin. 9 out of 10 patients feel isolated, depressed, and hopeless, and 1 out of 4 women take time off of work due to incontinence. So, let's not be part of the statistic. Let's approach our healthcare providers, specialists, and definitely get your partner involved. Be open with your partner about how you're feeling. They can only support you if they understand what you're going through.
Yeah. Well, this is what Natalie and I teach all the time about getting, connection with your partners and having that conversation. But have you found in your practice a connection with pelvic floor dysfunction then? to do with any like trauma or things that have happened in the past, emotional stress, any of those things? Is there a connection there? I mean, yes,
Oh,
hormones are a thing, but is there a connection? Have you seen that in your practice?
absolutely. There's actually a very big connection, and chronic stress can contribute or worsen pelvic floor dysfunction because it causes muscle tension, and it could lead to a condition called non-relaxing pelvic floor dysfunction. So just like we spoke about, the knot in the shoulders, we say, oh, people carry their stress on their shoulders. People actually do carry their stress in their pelvic floor as well. If you look at persons experiencing pelvic pain and they have no other causes of the pelvic floor pain, if you look at what they do for a living, they usually have very high levels or high stress jobs. So chronic stress from whatever it is, whether it's at your workplace or a history of trauma, etc., can definitely affect the pelvic floor. And it's sometimes harder to treat. I tend to refer them out to a psychologist or a counselor, whatever.
Okay. No, that's a very good it's a good point because a lot of women, the society that we live in, I think we all walk around with so much stress on our plates. And as Natalie says, sometimes you're not sure, is it, we're sweating, we're maybe having hot flashes and it's happening and all of that. So I think it's important for women to really be tuned in their bodies, that if something doesn't feel right, check your stress levels. Excuse me. So let's talk a little bit about lifestyle changes. What can we do to empower ourselves as women, from diet to nutrition to types of clothing that we wear to, I don't know, what is it that that we can start doing little bits for ourselves before,
Yes.
you know?
You mean in terms of preventative tips?
Yes, yes,
Yes, even women in their 30s or 40s before they get to perimenopause or menopause.
yes.
I would say maintain a healthy weight, right?
Okay.
I cannot emphasize enough how beneficial exercise is for overall well-being. Um, Excess weight can put pressure on the pelvic floor, as I mentioned earlier, and it causes weakness and dysfunction to the pelvic floor muscles. So regular physical activity, not just aerobic activities, but resistance exercises and core strengthening as well.
Mhm.
Practice good posture. And yes, posture can affect the pelvic floor. We all heard the song with the hip bone connected to the thigh bone when we were young. There actually may be some hidden medical advice there because the pelvic floor does not work in isolation. Nothing in your body works in isolation. So if we take this pelvis, for example, and let's say you're always in a slouch position and you're sitting in a slouch position for prolonged periods, instead of you sitting upright on the sit bones here, you're sitting that way. So you're sitting on your sacrum. What does this do to the pelvic floor? It lengthens and stretches the pelvic floor, causing it to become weak. So good posture is very important. Avoid straining with bowel movements, as I mentioned before. Even if you don't have constipation, you're trying to like get it out of the way so you can go to work. No, that is not good practice at all. Take your time, deep breaths, never strain. If you can, limit caffeine and alcohol intake because these are bladder irritants. So it causes the bladder to contract more and may cause increased frequency and urgency symptoms. Stay hydrated. Now, this is a catch-22 because I know some people will not drink enough water, so they don't have to go as often, but this may make their incontinence worse because it makes the urine more concentrated, it irritates the bladder, and increases symptoms of urgency and frequency.
Mhm.
So hydrate, maybe not too much, but hydrate sufficiently for you. And if you don't want to wake up in the nights to go to use the bathroom, stop all liquids an hour, hour and a half before bedtime. So it limits either nighttime wetting or avoiding getting up in the nights to use the bathroom. Eat a balanced diet. So avoid constipation, eat diet rich in fiber, and it takes the strain off the pelvic floor because you don't end up with constipation. Avoid heavy lifting. Now, what is heavy? It depends on what is heavy for you, but avoid heavy lifting is just a general statement out there. So you bear in mind, when you go to the gym, it's not the heavier the better. It's what you can tolerate because heavy lifting puts strain on the pelvic floor muscles. Another thing is quit smoking. if that's an option. I think that is great advice for everyone across the board. But smoking can lead to chronic cough, which puts strain on the pelvic floor. Right.
Everything is linked, without a doubt.
Everything is linked. And of course, pelvic floor exercises, it is never too early to start pelvic floor exercises. It helps to strengthen the pelvic floor muscles, improving bladder and bowel function, and reduce the risk of developing incontinence.
Those are all very good things. And we have one question here before we move on to some other stuff. Tanya's asked, I have Crohn's disease. You have made me more aware of some of the pains I feel. Awesome, Tanya. Tanya, the question you had was how can it be fixed? I think you were talking about I think we were talking about the prolapse at that point. You're saying it can't be fixed. It can be fixed, can be reversed. How does that work?
It can be reversed, not from pelvic floor physiotherapy. Prolapse you're talking about, right? So
I think that's what Tanya was asking, yes.
No, prolapse cannot be reversed. We can prevent the progression of it or the worsening of it through these exercises, pessary, lifestyle modifications, but we can't reverse it, no.
Okay. Okay, Tanya, did that answer your question, or do you have another question? If not, you can just pop. Yeah, well, it's just you, Tanya, so you can unmute and ask if you'd like. Okay. It answered our question. Awesome. You talked about breathing exercises. Yeah.
Yes.
Simple breathing, specific types of breathing. What kind of those exercises?
So let me tell you how breathing and pelvic floor is connected, right?
Okay.
So you have the pelvic floor at the bottom, the diaphragm at the top. As we take a big breath in, the diaphragm descends and flattens. So that allows the pelvic floor to descend and lengthen. And as you breathe out, the diaphragm goes back up and the pelvic floor contracts a bit. So breathing and the pelvic floor movement go hand in hand. So if you have very shallow breaths, you can develop dysfunction of the pelvic floor because you're not allowing the pelvic floor to descend and relax. Again, I go back to the bicep. How functional is the bicep if I cannot extend my arm fully? So I'm contracting fully, but I can only go to here. How functional would my arm be? That's the same thing for the pelvic floor muscle. Contraction to the max is as important as relaxation, or relaxation is as important as contraction for the muscle to function optimally.
Okay. So is there a specific type of breathing or just regular deep breaths?
Deep breathing. I usually say, big belly breaths. So as you take a big breath in, watch your abdominals rise or abdomen rise, and then you can see the chest moving. So that ensures the extent of the descent of the diaphragm, allowing the pelvic floor to descend and lengthen as well.
I find that as women, we don't breathe properly. I think that we almost like we hold everything in as because we live with this stress. I find myself, I don't do proper breaths. I don't do my deep breathing and relax. And so that, of course, is going to tense up everything in our bodies. So I think that breathing is something I know I need to learn to do deeper breathing.
Absolutely. Like I actually find every once in a while I take a breath and I think to myself, wow, I think I was holding my breath before this. Like I don't think I was actually breathing. Yeah.
Did you feel your pelvic floor relax as you were doing that?
I do.
I will pay attention and see.
Yes. Yep. There are actually studies that link chest conditions like cystic fibrosis, for example, with pelvic floor dysfunction. 30 to 60% of persons who are diagnosed with cystic fibrosis. So cystic fibrosis is a condition where the lungs don't expand as well. So you can't take big breaths. And they found that 30 to 60% of these persons have pelvic floor dysfunction. So you can see how taking that big belly breath and taking deep breaths is important for the pelvic floor.
And it also helps with our stress levels too.
Yeah, right. Wow, who knew? So
before you snap at that taxi driver on the road who cut you off,
take a deep breath.
Yes.
Okay, so you said that pelvic floor prolapse cannot be fixed, but we can prevent the progression. If a woman is experiencing incontinence in any way, whether through leaking or frequent urination, can that be reversed?
It depends on the cause. There's no hard and fast answer to that. So it depends on what's
Okay.
causing the incontinence. Is it weak pelvic floor muscles? Is it a pelvic organ prolapse? Is it overactive bladder that's causing it? So it depends on the cause of it. But generally speaking, if it is straightforward, so to speak, just like we rehabilitate any other skeletal muscle in the body through a series of strength training, relaxation exercises, stability exercises, it can be reversed. But then again, it would, as I said, it depends on the cause of these symptoms.
Okay. Okay.
Does this happen to men? Can men benefit from this too? I mean, should we be speaking to our partners?
Absolutely, absolutely. So men have similar symptoms when it comes to bowel and bladder. However, their pelvic pain is more related to the prostate. Um, they may need pelvic floor physiotherapy after surgery, to remove the prostate for prostate cancer. Half of my clients right now are actually males. Interesting, right? You would think it's more females. But yes, they have urinary incontinence and erectile dysfunction, sometimes pelvic pain, but most commonly it's incontinence and the erectile dysfunction as a result of prostate cancer surgery. So pelvic floor physiotherapy can help with that. Pelvic pain in men is usually related to infections like UTI, STI, chronic stress that we spoke about.
No, the stress thing is a big thing. Yeah.
Men can absolutely benefit from pelvic floor physiotherapy.
So, Chitra, just based on everything that you've said so far, we have these sort of guidelines like when you reach a certain age, you should start to do breast cancer screening. When you reach a certain age, you should do like cervical cancer screening, prostate screen. It almost sounds as if when you reach a certain age, you should do pelvic floor health screenings.
Absolutely. I would say as soon as you get to reproductive age.
Really?
The reproductive age, you mean like 20?
No, well, I meant as you get your period, but that's not the case. But I would recommend when you start thinking about having a baby, possibly, or before you start. I don't want to say before you start intercourse, but I would recommend before, when you're thinking of having a baby, for sure, that would be a good timeline to consult a pelvic floor physiotherapist. If you're having symptoms, ideally we would prefer the referral route, where you go to the doctor first, let them do all the necessary tests, the ultrasound, the urodynamics, etc., and then refer to a pelvic floor physiotherapist. But we're here, we're available, we're accessible should you have any concerns, even if you want to know how to contract the pelvic floor muscles and you're sure.
So people can just come straight to you. They don't need a referral, or they have to go to their doctor first. They can come straight to you.
Correct. If I think they need to see their doctor, then I will send them to their doctor. Or if they're using insurance, they need to be referred by their doctors.
Oh, okay. And then you would just have a consultation with them, depending on their symptoms, if they're in menopause or not menopause, and then you would show them, all the different techniques and stuff to use, which I think is actually quite interesting. I love that. I think it's amazing. What is one, Natalie wrote this question, I think it's a great question. What's one myth about pelvic floor health you wish women knew the truth about?
So there are lots of pelvic floor myths, but for the purposes of this talk, to tailor this talk, one myth I think is very important is urinary incontinence is a normal part of aging. That's a myth. It is not. It's absolutely not a normal part of aging. And neither is painful intercourse. The first thing you'll want to remember is that bladder leaks during menopause are not normal. And the incontinence problems are things that don't have to be endured. So, while menopause may be unavoidable, the symptoms that you experience from it don't have to be. So don't, it's not par for the course. Don't say, this is just normal. It's not. Seek help, It's far better than suffering for years, especially with a condition that is otherwise treatable.
Okay. That's a big one. But you said there were other things, other myths. What other? You said you wanted to tail in for this, but I'd be interested to know.
Only women have pelvic floor.
Right. Well, we know that men have.
Um, painful intercourse is normal, which
Yeah.
it isn't.
Mhm.
Kegels is all you need, you know? Do your Kegels all day, every day, and you should be fine. That's a myth because Kegels, as I said, Kegels are not
Okay.
for everybody. Pelvic floor muscle contractions are not for everybody. Sometimes all you need is relaxation.
Okay. That's
It depends on
important. That's a very important thing. And a lot of women do not know the difference. We talked about this a while ago, the Kegels and the pelvic floor tightening on. What do you tell women who say, well, I do my Kegels and it works or whatever? What do you tell women?
Well, if they're not asking me anything and they're just saying it, I'd say, well, good for you. I hope it's helping, you know?
Yeah.
But, or I would say, you know, if they're coming to the office versus a social conversation, of course, if they're coming to the office, I would ask them about other things, you know, I usually say I help with three main things: pee, poop, and sex. So are you having any issues with any of these? You know,
Okay.
and get the conversation started, and then we go from there. And you know, if they say, oh, you know, sometimes I find penetration a little painful, and I'd say, maybe you want to rethink those Kegels. You know, maybe you should be relaxing instead of contracting. So opening up these conversations with the patients can help to determine if that's right for them or not. And sometimes you just have to do an assessment, see if
Mhm.
it is relaxing properly or not. That's again, if you want an objective measure, that's where the biofeedback comes in to check if they're fully relaxing.
I love that. I really do because, like what you said a while ago and earlier is that sometimes what we're doing or what the ladies are doing actually can make our situations worse and they don't even know that that's the case. So knowledge in this situation, knowledge, always every situation, knowledge is extremely powerful,
Yes.
but it's that a lot of women don't realize. I mean, I'm just learning here today that, you know, it actually can be working against a woman if she's doing her Kegels versus relaxation techniques. And I think every woman needs
And
to
men
know that.
too.
And men.
Absolutely. Yeah, absolutely. I didn't know that. I just try to practice them every time I'm at a stoplight or
Yes.
whatever, like randomly throughout the day. But
Yes.
you're saying I could be doing more harm than good.
Yeah.
Yes. I mean, I don't want to say you could be doing more harm than good. I mean, if it's working with your symptoms, go for it, you know. But if you find that you're doing it and your symptoms, if you have
Not
any,
improving. Yeah.
worsening or it's not improving, then you know you should rethink and say, maybe this is I'm not doing the right thing. Maybe I should, you know, look into it.
Hmm. Yeah. Knowledge is power. What are the top three things every woman should do to support her pelvic floor health as she ages?
Some of the preventative tips I mentioned earlier would also apply here, but if I'm to choose a top three, it would be learn to isolate your pelvic floor muscles for a contraction and
You
then
need
do
to
it.
hold a class on this, man. You need to do a class on this for us
Yes, for
because
sure.
we need a class on that. Anyway,
You
sorry,
mean
go ahead.
you mean how to do the pelvic floor muscle contraction?
Yes, we need to have a whole other segment on just that alone.
Okay. So yes, I mean, learn how to isolate your pelvic floor muscles for
Okay.
contraction and do regular pelvic floor exercises. Of course, you would have to see a pelvic floor therapist first, who would
Mhm.
determine your strength and your endurance, and the exercises are tailored for you. You can't be doing 10 squeeze and hold for 10 seconds when you're unable to get to 10 seconds and all you can do is 5 seconds. And you know, you're like, I can't hold, I'm trying to hold, but I can't. Maybe your muscles are not strong enough for you to hold for 10 seconds. Maybe they can only hold for 2 seconds. So you practice for 2 or 3 weeks with 2 seconds and then you progress it, you know. So a
Mhm.
pelvic floor physiotherapist would be able to assess and tell you what your strength and endurance are. The other thing, as I said before, is maintaining a healthy weight because excess weight puts strain on the pelvic floor. And the third thing, probably sound like a broken record now, is practicing good bowel habits. Go
It's
when
not
you
a
need,
broken record. It's good stuff. Yes.
go when you need to go. Be patient and use good posture. Never ever strain. So
Okay.
those are the top three that I would
Three.
choose.
I'm writing them down.
Mhm.
Okay. Great. Um, is there a link between women who are having constant maybe bladder infections or UTIs or with pelvic floor issues, or are they
There may
separate?
be there may be a link. I mean, most likely there is a link because they're probably not emptying their bladder fully, which is what makes them get repeated UTIs. One advice I usually tell my female patients is to use the bathroom after intercourse.
Okay.
So that decreases your risk of getting a UTI. And of course, when you get these repetitive or frequent UTIs, the pelvic floor goes into spasm and it tightens up, right? And remember, we spoke about where to break the cycle because that then causes more pain, the tightness of the pelvic floor muscles. So yes, there's definitely a link between, hygiene practices or just your lifestyle and the pelvic floor.
You talk about hygiene practices. I had mentioned about clothes earlier, but are there different hygiene practices for women, especially in menopause or perimenopause, that we should be doing differently? The reason I ask you this is on a previous episode, we talked about not using, for ladies, not using any kind of soap or whatever when we wash
Right.
down in our vagina area. Yeah, is that something that we
So
should be?
I wouldn't say don't use any soap at all because, as Natalie mentioned earlier, we sweat. We live in a hot country, but
Yeah.
no douching, you know?
Okay.
Yes, and no harsh soaps. Let it be a gentle soap. And all you need to do, if this is the external genitalia, is just hose. You can just hold the handle of that shower head and just hose the external genitalia. There's no need to go inside, right?
Okay.
That's one. Clothing, as you mentioned, is a big, big one. We tend to wear these nice, we want to avoid the panty lines and we wear these nice thongs and we wear the no-show underwear. They're not healthy, right? They promote the growth of bacteria, increase the risk of UTI. So if you have the option, cotton underwear is best and avoid tight clothing as well
Okay.
to prevent shear force between the clothing and the urethra, which can cause, urethral abrasions and UTIs as well.
Okay. So all those ladies with those tight, skinny jeans, something to think about, especially living in a tropical country where we are hot and sweating.
Mm-hmm.
Plus we have our menopausal hot sweats, plus all of this happening. Oh my goodness.
Mm-hmm. Correct.
Something to think about. Okay. You recommending for women any tools, apps, websites, anything that women can, I mean, definitely I am all for speaking to a gynecologist if you're feeling comfortable first with that person, because as I said, for some women, they get a little embarrassed about it. Of course, speaking to you and getting a consultation and just finding out where you're at with your pelvic floor, I think for women is very important. But if we were to go Googling, we are going to find all manner of things that we probably don't want to find.
Yes, 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 yes.
What would you share with us on
Well,
that?
first of all, stop Googling.
Okay.
Yes. So my recommendation for apps, I really work with two apps. One is Squeezy, Squeezy, and the other one is Easy Kegel. They are great apps. Once you've been to your pelvic floor physiotherapist and you know that, your strength and endurance, and they've determined that strengthening is right for you, these apps are really useful because instead of you sitting there and counting, oh, am I on the fifth rep? Am I on the 10th rep? How long have I held? You can program these parameters in the apps and they will do the counting for you. So it'll say squeeze and let go, squeeze and let go, and that series. And it will also give you reminders throughout the day as to when you need to do your exercises. I usually recommend 10 sets of quicks, 10 sets of pulls, 3 times a day.
Okay. Well, these are
So
great apps.
yes, you can program these. Now, with respect to resources, just on pelvic floor information, there's a wealth of information, so you don't go Googling. There's a wealth of information on the pelvic floor on these websites. One is the National Association for Continence. That is the statistics that I quoted earlier. There's mypfm.com and there's International Pelvic Pain Society. And these are all nonprofit organizations dedicated to improving quality of life for individuals with incontinence and related pelvic floor dysfunction. And they have educational handouts, they have support tools for persons dealing with pelvic pain. Another website is Beehive. They offer an 8-week exercise program focusing on core and pelvic floor exercise designed to support individuals during perimenopause and menopause. And there's a 7-day free trial. So go on the website, see if it's something that's right for you. Of course, if you have other comorbidities which limit your exercises, you may want to check with your medical provider first before engaging in these exercises.
Those are good stuff. What I'm going to ask you to do is to send me those links so when I send out the replay for the ladies, I'll drop that into the website into the email so that they can get that information, because I think it's, as I said, when we Google, oh Lord, it becomes, or go AI just kicks in and we hear all manner of things that maybe, and it's confusing. It can be very, very confusing for women.
Yeah, it's a rabbit hole.
Yeah.
Yes, and then you end up reading all these things that may not even be anything related to what you're going through, you know, but
absolutely,
it's frightening you in the long run.
Absolutely. Well, I mean, certainly from my takeaway from this conversation, which has been amazing, is, I mean, I have almost 30-year-old daughters. I think it's important that I'm going to start having this conversation with them, because this is something that they should be starting to to be aware of and talk and see. And it's never too early to find out where you are with your pelvic floor health. Yes. And that there is support with you and physiotherapy, pelvic floor physiotherapists, that there are exercises that can work, and that perhaps maybe the stuff that we've been taught back in the day, growing up, like us, my generation, maybe are not working out for us, that it actually could be hindering us rather than helping us during especially our menopausal stage. So again, knowledge is power for us ladies, and it's just never too early to start. And don't be embarrassed about it. It is part of our life.
Yes, you may feel embarrassed, and that's okay. But just remember that the medical professionals that you'd be speaking to, they have these conversations every day. These are normal daily topics for us.
Yeah, and it's better to have a conversation than to be embarrassed and suffer in silence and not get the help you need to prevent what's going on or improve. Yeah, absolutely.
Awesome. Well, thank you so much. We so appreciate having you on the show. And as I said, this topic, we cannot talk enough about this topic, because it is real, it is happening to ladies. And the more we speak about it, just like menopause, is the more awareness that we can, support each other as women, without a doubt. And of course, our men who are our partners who are on this journey as well.
Yes.
Absolutely.
Thank you for having me.
Awesome. All right, ladies, have a good rest of your day, and see you on the next Menopause Monday.
Yeah, this is awesome, Chithrah. Dr. Cherian, thank you so much.
You're most welcome, Ashley. Bye, Nikki.
All right, honey.
Bye now.
Bye.
Bye-bye.